Hi, I'm Keith Adam. I'm the Chief Medical Officer for Sonic Health Plus. Many of you may have heard my name, but you may not have met me face to face yet. I've been working in the industry for quite a long time. I initially ran my own business, but ultimately that was sold to Sonic Health Plus. So I've been with Sonic Health Plus for about the last 5 years. As Chief Medical Officer, I guess my role is to try and maintain the clinical quality and advise and assist doctors to provide high quality services all the time. In another way to explain it is my desk is where the buck stops. When there's a difficult problem that needs to be sorted out, then it usually winds up on my desk, and I, along with the rest of the clinical governance team, often have to work out the best solution. I think the thing that sets SHP apart is that we're a doctor-led and doctor-driven model. While we do have the opportunity for using nurses and other staff, where it's required in a medical assessment, we always use a medical practitioner. I think the advantage of the doctor-led model is that where the clinical assessment requires it, a doctor has a greater breadth of clinical experience and may pick up on subtle clinical signs or subtle items in the history that may indicate serious disease, which might be missed with someone who doesn't have that training. The value of our occupational focus is that we understand the workplace, we understand the demands and the requirements, and so we can provide solutions and advice that are tailored to that particular environment. While the local GP has a lot of medical experience, and I think they do a great job, they don't have that depth of occupational experience, and sometimes they make recommendations which just don't take that into account. For example, I often see people working in safety critical jobs who are prescribed narcotic analgesics for a particular condition, and they just can't do safety critical jobs when they're taking that medication. In my role as Chief Health Officer, I'm often called upon to interact with our clients, and I think the most important thing I can do is, particularly when we're onboarding a new client, is to really talk to them and understand what their needs are, what problem or concern they have, so that we can make sure that we're doing the right tests and the right investigations to give them the answer they need. When we're providing services to our clients, it's most important that we understand the specific needs of particular occupations or particular industries. In some cases, there are regulatory requirements that need to be met. For example, in the transport industry, where the medical process is quite regulated. In other situations, it's a matter of us providing guidance and advice to the client company about exactly what's required. For example, I have assisted in the past in developing a new medical standard for firefighters. For my part, I've been involved over the years in the fertiliser and chemical industry. I've been involved with emergency services, particularly with the fire service, and I've had a lot of involvement in the rail industry and a bit less in the transport industry. I guess I've had the opportunity to have a fairly unique experience in sitting on medical assessment tribunals, where I was for many years involved in psychiatric tribunals, so I've had some particular experience in assessing people with psychiatric disabilities. While I don't claim to have the same expertise as my psychiatric colleagues, it certainly helps to be able to assess a more complex case where psychiatric issues are part of the problem. I'm passionate about this job, and I have been now for over 30 years, because every day is different, every day is interesting. I find I've learnt so much about the workplace and how various things are made and done. And more importantly than that, work is important to people, and I think over the years I've been able to make a difference in people's health at work.